This episode of We're on ECMO is brought to you by Beyond Air. Beyond Air is a leader in providing innovative nitric oxide solutions. Their LungFit pH device is a groundbreaking inhaled nitric oxide generator and delivery system that has been developed to treat patients with persistent pulmonary hypertension of the newborn and other associated respiratory conditions. This innovative technology allows for on-demand nitric oxide generation from ambient air, eliminating the need for cylinder storage and improving operational efficiencies for healthcare facilities. Welcome to We're on ECMO, an educational series for the ECMO community. My guest today is Dr. Caitlin Demarest. Dr. Demarest is a thoracic and lung transplant surgeon at Vanderbilt. She completed her general surgery residency at Columbia University Medical Center and has a PhD in biomedical engineering and artificial lung development from Carnegie Mellon University, where her research focused on preventing clot formation in artificial lungs with nitric oxide. She completed her thoracic and lung transplant fellowship at the University of Michigan, and she's a busy lung transplanter and performs a multitude of surgeries for cancer of the lung, esophagus, mediastinum, and chest wall. Thank you so much for joining me today.
Yeah.
I appreciate you having you on today and taking the time to join us and share from your knowledge and experience as someone who's kind of focused on things in the nitric oxide world. And so from the beginning of extracorporeal use, this balance of clotting and bleeding has been an issue. Do you think nitric oxide will help us solve this issue?
It's a interesting thing to think about. It's so complicated to balance these two things. So as you mentioned, clotting and bleeding, they both happen. And the question, I think, like the most recent question that's most important is which one matters more, right? Which one you can bleed or you can clot, but like which one's more significant and which one provides more risk.
Mm-hmm.
And so traditionally with ECMO, we anticoagulated patients a lot and fully, and that's what we thought was necessary to prevent clot formation, mostly in the ECMO circuit, because there's a large surface area and lots of clot potential. And so we give full doses of heparin, and many centers still do that. Some centers, ours included, have moved towards a less aggressive anticoagulation strategy. And what we have found recently, we're involved in a couple of randomized trials actually right now looking at this. And what we are finding is that even though there may be increased clotting in the patients you anticoagulate less, they do better because those complications are not as significant as when it's bleeding. And so we are trending as a community in a field towards less and less anticoagulation for ECMO. And so it would be a really important place where nitric oxide can come into play, to be maybe on no anticoagulation and just nitric oxide, if we can figure out the right way to make it work.
Gotcha. And so in the simplest terms then, can you tell us how nitric oxide impacts the blood to help prevent these clotting issues?
Yeah. So your blood clots with platelets. I think almost everybody knows that. When you get a cut, platelets go to that area. Platelets form a little collection that then clots the blood. Nitric oxide basically is a platelet inhibitor, and it prevents platelet activation. And so if we can prevent platelet activation, we therefore think that we can prevent clot formation.
Right. Do you think nitric in the sweep or nitric release from the surface of material will provide the greatest benefit? Do you have any way of knowing that?
Which one would?
The
Yeah.
nitric in the sweep or nitric.
Yeah, I guess, yeah, it's a great question. It really depends. So my work during my PhD was looking at nitric oxide clot prevention in the oxygenator itself, because the oxygenator is one of the primary places that there's significant clot formation due to that tremendous surface area of the oxygenating fibers. And so we looked at nitric oxide, number one, because it prevents that platelet activation, but importantly, nitric oxide has a very short half-life, and so it should work locally just in the oxygenator without working systemically and causing problems systemically for the patient. Because it shouldn't, by the time the blood gets out of the oxygenator to the patient's systemic system, the nitric oxide should be gone because the short life, half-life is so short. And so what we did during my time during my PhD was put it in the sweep gas in these little oxygenators we would make, and I would attach to rabbits. And when I put nitric oxide in the sweep gas of those little oxygenators, the clot formation was less, and there was less of volume and weight of clot afterwards, with no effect to the bleeding or other laboratory values of the rabbit itself. It just acted within the oxygenator.
Mm-hmm.
And so oxygen in the sweep gas, I mean, nitric in the sweep gas is promising. We've been looking at this for a very long time. There's lots of people that have looked at this before. Finding surfaces that can generate nitric oxide is really appealing because that would also work right at the surface to prevent that platelet activation, again, without working systemically. The biggest challenge with that would be finding some way to generate nitric oxide in a durable way, right? How can you get that to be continuous or last a reasonable amount of time, where it wouldn't like run out, depending on the means by which you have the surface to generate it. But I think that would be like very promising if we can figure out how to do that in a durable way.
Absolutely. What is your prediction regarding how soon we'll be able to have a clinically applicable practice to help?
I think so. There's so much work with coatings right now in artificial surfaces, and we are looking at in our research, some of the stuff I did during my PhD was looking at also alternative means of clot prevention with coatings. And it's really kind of a hot area for a lot of research.
Mm-hmm.
I would, if I could guess, I mean, I think it's a focus of a lot of people's interests right now. And so I would guess, in the next decade, hopefully we have something like this. When I got my PhD, that was 2014, so it's already been 10 years. If you asked me then, I'd probably been like, we're almost there.
Yeah, sure.
5 years maybe, but it's already been 10 years. So, hopefully soon, because so many people are taking an interest in working on this though.
Absolutely. No, well, thank you so much for your time and your willingness to share from your experience and expertise. I know, ECMO itself is, still fairly new to the world of medicine. And so all of these things that come alongside that, even when it's been 10 years, and we feel like we wish it was farther along. Strides are happening all over the place. And so thanks for folks like you doing research and others who are out there doing that. And hopefully we'll see some more impacts for patient care and coming soon. Our big thing at ECMO Advantage is just working towards this goal of helping patients thrive, not just survive. And so all of these research activities that are going on help with that. And so thank you again so much for that. If you're watching today and you have an ECMO related question you would like to see discussed, please email me, Neil, Neil, at ECMOadvantage.com. Thanks, and we'll see you next time.